Hello, welcome and thank you all for joining me for my webcast today. I'm going to be broaching the subject of oral hygiene today. Now, we often hear the term hygiene and we don't always know what specifically that means. We kind of think towards showering and washing your hands and all these important cleanliness things. Now, with oral hygiene, it's the same thing. You're talking about being clean and healthy, but we're specifically talking about being clean and healthy in your mouth. And dentists across the world have come up with a set of recommendations that can help us do this, because it's very important that we keep our mouth clean and healthy because it's connected to the rest of our body and it can impact the rest of our body's overall health. And so to start off, I'm going to share a video with you that discusses why we should specifically care about the oral health and hygiene of our children.
Hi, I'm Dr. Lonray Falusi with today's tip for kids from the American Academy of Pediatrics. Did you know that tooth decay is an infection? Luckily, cavities are largely preventable. The bacteria that cause cavities pass from parents to children, so good oral health is a family affair. Take care of baby teeth as soon as they emerge by brushing them with a smear of toothpaste with fluoride. Talk with your pediatrician about your baby's oral health and take him to the dentist by age 1. For more, visit healthychildren.org.
All right, so
Hi.
super in depth, but it talked about how it's important that we take our kids to the dentist because they can get cavities, and we don't like cavities. They can be painful and they can be annoying, and then you have to make more trips to the dentist, and no one really enjoys trips to the dentist. But even more than cavities, poor oral hygiene can actually lead to bigger and more dangerous diseases. This can include gum disease, heart disease, lung problems and infections, and other infections including abscessed teeth. And these can become really big problems, especially as your child gets older. And when you get older, your health can start to go down anyway, and we like to prevent as many bad situations as possible. And we can do this by helping them get these good habits while they are young and get them in the habit of following the dental recommendations so that they don't have heart disease or pneumonia later in life because they didn't properly take care of their oral health. So we've been talking about these dental recommendations, and they're pretty simple. Most of us have heard them before. Brush your teeth twice a day, floss twice a day, visit a dentist and hygienist every 6 months. A lot of us do this, a lot of us say we do this. They're pretty simple things, but we don't actually always do them. But the recommendation is that you brush your teeth once in the morning and once at night before you go to bed, and that you also floss your teeth twice a day. They aren't as strict about doing it, right when you get up, right when you go to bed with flossing. Just twice a day is the recommendation. You can do it after breakfast, after lunch, after dinner, in between, anywhere in there. That can just help keep your gums healthy, and it also helps prevent cavities, which can later turn into abscesses, which can then in turn turn into bigger infections and eventually pneumonia if you don't get it taken care of. And by visiting a dentist and hygienist every 6 months, this just helps have a doctor look at your teeth so that they can see if there's anything that possibly needs to be taken care of or that needs a closer look, because dentists and hygienists, they also want us to keep our mouths healthy because they are aware of what a big impact having poor oral health can have on the rest of our health, and they are in the business of taking care of us and keeping that from happening. Got another video to share with you.
Did you know that children should have their first dental visit after their first tooth appears or before their first birthday? This visit is important because as soon as your child's baby teeth appear, they can develop cavities. In most cases, the first visit is mainly for the dentist to examine your child's mouth and to check for growth and development. During the visit, you can expect the dentist to check for mouth injuries, cavities, or other problems. If your child is going through a tough time with teething or in the habit of thumb sucking or excessive pacifier use, ask your dentist for advice on how to handle these issues. When scheduling the appointment, Try to choose a time when she will be more cooperative. Morning appointments tend to be a good time. Try to avoid scheduling an appointment during her usual nap time, since this could lead to a cranky visit. Some dental offices will give you the opportunity to fill out paperwork ahead of time. If you have dental insurance, be sure she's included on the plan before the appointment. On the day of the visit, make sure your child has had a light meal beforehand. Some children may gag, so you want to avoid a heavy meal before the appointment. Try not to give snacks in the waiting room, because those will be all over her teeth during the visit, which will make the examination difficult. Here are a few tips to help make the experience positive. Try not to let her know if you're concerned or anxious about the visit. Children can pick up on your emotions, so emphasize the positive. Don't use a dental visit as a punishment or as a way to bribe your child. Talk with your child about visiting the dentist. Let her know that she's going to meet new people and ride up and down in a dental chair. Have her practice opening her mouth so that the dentist can count and check her teeth. Make it fun and let her look and count your teeth as well. There are many children's books and videos that can help you prepare for the visit. Reading stories or watching videos about a first dental visit may help your child be less fearful and more confident. If she's upset during the visit, work with your dentist to calm her. It's important that you trust the dentist and let them lead the conversation. Give the dentist a chance to turn the visit around. Don't wait for your child to start school or until there's a dental emergency for her to go to the dentist. Being proactive about the future of your child's dental health today will help her for the rest of her life. To learn more about taking care of your teeth and gums, visit mouthhealthy.org.
All right, that video had a lot of great tips and suggestions for taking your children to the dentist. And it doesn't apply just to younger children. It can apply to older children if they don't see the dentist often. And getting them into the habit of seeing the dentist and recognizing that it isn't necessarily a scary thing that has to be unenjoyable like we often stereotype it to be. All right, and the campaign that I am helping host is called the Truth or Dare campaign, and our website is up and running, so I've provided a link that you guys can look at if you are interested in finding out more information on how and why we care about our oral health and hygiene, how we are working to take care of that. You can also call the campaign supervisors at the number listed, and please follow us on Facebook, Twitter, and Instagram. And if you have any questions, please feel free to reach out to me or use our online chat on Facebook and Instagram. And thank you for joining me today, and that's all I have for you. Thank you.